This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2021. The International Classification of Diseases, or ICD, is a diagnostic tool used globally to define comorbidities and complications. It is commonly used to report the cost and effectiveness of interventions and surgical outcomes in orthopedics. The previously used 9th edition of ICD, called ICD-9, was revised to ICD-10 to incorporate greater detail and new technologies and procedures. Though this has improved the specificity of diagnoses fivefold, it has also increased code mismatches in diagnostic algorithms. Whether the transition from ICD-9 to ICD-10 affects the calculation of the prevalence of comorbidities and other risk assessment indices is unknown. Scientists recently examined the trends of comorbidities and complications after the transition from ICD-9 to ICD-10 coding in 2,006,581 patients who underwent primary total hip or total knee arthroplasty, THA or TKA. They used data from the Premier Healthcare database from the fiscal years 2011 to 2018 to calculate the odds ratios of change in levels and slopes of comorbidities and medical complications. They found that comorbidities, such as congestive heart failure, hypertension, and obesity, had a significant but clinically small discontinuity after the transition. Complications also showed significant discontinuity with odds ratios of 0.66 for pneumonia, 1.88 for acute respiratory failure, 2.54 for sepsis, and 1.79 for urinary tract infection. Moreover, the prevalence of alcohol abuse and paralysis decreased after the transition, whereas the prevalence of metastatic cancer, weight loss, and acquired immunodeficiency syndrome, AIDS, increased after the transition. In general, complications showed a decreasing prevalence over time. This study shows that after the transition from ICD-9 to ICD-10, most comorbidities showed minor discontinuities, and complications showed decreased prevalence. Therefore, these findings suggest caution while using ICD coding when conducting joint replacement studies that include transition periods.